Hi guys, so we are back with Once Upon a Case. I'm Dr. Shivangi, a family physician.
Dr. Pratibha, gynecologist.
And today I have a case to share that I experienced when I was posted in the emergency department as a postgraduate. So we had a 30-year-old male patient who was a farmer by profession and came with complaints of giddiness and a pinprick type of sensation as he was working in the farm previously. So this was like a really hot summer day. So we initially thought of very common causes such as dehydration, and I was the one who took the history, did the initial assessment, and there was no other past relevant medical history, no other medication that he takes. So we did like the basic examination, and also for the sake of protocol, I also did an ECG because of the persistent giddiness. And thankfully I also did a troponin I test, which is a test to look for any insult to the cardiac muscle. Both the tests were negative or normal, and I was also under the supervision of a senior consultant who told me, because of the persistent giddiness and he was also feeling a bit uneasy, he told me to keep the patient under observation for an hour and then to repeat these tests again. So this time the ECG showed massive changes, and the troponin I test, which is for checking insult to a cardiac muscle, was also positive.
I just want to know one thing, why it took 1 hour for the changes to be evident in ECG?
So when this is the reason why we actually ask the patient to stay for observation when we are having a suspicion that this is an evolving myocardial infarction or a heart attack, because at the starting stage of a cardiac arrest, when the heart muscle starts getting affected, it might not always reflect on the ECG immediately, and even the cardiac enzymes that we are expecting to get elevated does not happen initially. Over a period of time, as the insult becomes more and more prominent, the changes on ECG also reflect that over a period of time. And even similarly, the cardiac enzyme, the troponin I, that is released by the heart muscle, increases over time as the insult is progressing. So that is why it's imperative to keep the patient under observation if we are having some suspicion. So anyway, so this patient thankfully agreed to stay for observation, and then we immediately moved the patient to the cath lab for an angiography and further management that was taken care by the cardiac team. So, and he lived to tell the tale, and it was obviously very surprising turn of events for him who had just come up with giddiness. So this is the importance of doing or repeating an ECG or a troponin I in such cases where we are suspecting an MI. So yeah, thank you.